Hello everyone. Very good evening to all of you guys. Myself, Dr. Vaibhav Jain, and today we will be discussing about the topic number 2 in the GIT part. Right, this is the continuation of the series that we are doing the live classes. Right, so this is a 90 days. This is a 90 days university prof pre-final mastery
Hello, 1 minute,
program.
sir. I will start recording, sir. 1 minute.
I've already started.
No. I wish you 1 minute. We
Okay,
should do recording in
cloud.
cloud, sir. Okay.
Okay. Hello everyone, very good evening to all of you guys. Myself, Dr. Vaibhav Jain, and today we will be discussing about the topic number 2 of GIT. We will be discussing about the very important and most common thing that you are finding every day in the hospital, that is nausea and vomiting. We will be discussing about the vomiting, and these are the 90 days university prof pre-final mastery program where you are having all the rapid revisions. You are having like quick live classes. Okay, and the topic for today, we will be taking two short topics. One is about the vomiting, and then what are the drugs we are going to write in that particular segment. What are the classification of all those drugs? I would be making you understand all those things, right? Why to choose Oracle? Because you will be getting those recorded classes, live classes, practical sessions will be there, exam modules will be there, and hard copy sets you will also get, right? So these are the pointers you should always like keep in mind. And just to take the subscription, right, you will be getting those live classes. You will be having these express exam modules, which is a rapid revision kind of thing, right? One-to-one doubt clearing session you will be getting, where you can directly ask your doubt directly to the faculty. Apart from that, you will be getting those hard copy notes, right? And you will be getting that question bank. These are the things, and practical sessions are also involved. That is a very beneficial thing for all of you. These are the plans that we are having, like foundation plan, we are having advanced plan, complete learning plan, and ultimate MBBS plan, which will be covering all of the 4 years of your med school, right? And this is my code that you can always use for the discount, that is Dr. Vaibhav Jain 20. Okay, so without any further delay, let's get started with the thing number 1 that we are going to discuss today. That is about the anti-emetic drugs. That is about the anti-emetic drugs. So the question is, classify the anti-emetic drugs and their mechanism of action. So before proceeding into that, I would like you to answer what is like vomiting. What is a vomiting? So let me write it down for you. So vomiting is what? Basically, what is vomiting? Vomiting is basically there will be forceful expulsion of all the gastric content. There will be forceful expulsion of gastric products. There will be forceful expulsion of gastric products. It is a type of reverse peristalsis. Basically, what is happening, whatever things you are eating, that is directly going to the lower part of the alimentary canal. It is always going in the unidirectional, right? But sometimes, you know what happens? The food is again coming back through your mouth. That is what is vomiting. It is a protective reflex. In most of the cases, whatever wrong things are going, they will be coming out, right? So this is a vomiting, right? Vomiting, what are the two important centers you should be concerning about vomiting? First one is your vomiting center. Where is the location of this particular vomiting center? If they ask you, the location will be, it is present in medulla, in the brain stem. It is present in the medulla. Apart from that, second most important thing is chemoreceptor. This is your chemoreceptor trigger zone, right? It is present outside the blood-brain barrier. Remember, it is present outside the blood-brain barrier near the brainstem itself, right? So these are the two important points you have to remember for the vomiting. For vomiting, these two important things will play a very crucial role, right? Now, let me make a schematic diagram for you so that you can understand. First thing we are having is your vomiting center. Suppose this is your vomiting center. And second important thing we are having is your CTZ center. CTZ center, that is chemoreceptor trigger zone center, right? What are the important points, how the vomiting is occurring? Let me make you understand. Then only you will be able to understand about the drugs. First, you should be learning about the basic physiology, right? So in chemoreceptor trigger zone center, what are the important things? There are some receptors. Okay, so I have already told you it is present outside the blood-brain barrier. So there will be, suppose this is your blood vessel, and in that particular blood vessel there is some kind of cytotoxic drug. Suppose there is some kind of cytotoxic drug. What is going to happen? This cytotoxic drug, or like chemotherapy agents, they are going to activate this chemoreceptor trigger zone, and it will be activating, in turn it will be activating your vomiting center. And now what is going to happen? This vomiting center is responsible for vomiting. This vomiting center is responsible for vomiting. What will happen whenever this vomiting center will get activated? It will be producing some changes in your body. What are those changes? First thing, it will be relaxing the lower esophageal sphincter. First thing, it will be relaxing the lower esophageal sphincter, then only the food can come out. Second thing, it will be contracting your diaphragm and abdominal muscles. It will be contracting your diaphragm and abdominal muscles. Basically, why abdominal muscles are contracting? When they will be getting contracted, what will happen? There will be increase in the pressure. There will be increase in the intra-abdominal pressure. There will be increase in the intra-abdominal pressure. And because of that forceful contraction, what is going to happen? Everything is going to come out from your mouth, right? Apart from this, it will also close the epiglottis. This is a very important reflex, that is closure of epiglottis will be there to prevent the aspiration. Basically, if epiglottis is not getting closed, what will happen? The gastric content can go into the lungs. It can cause aspiration, pneumonia. So, other things can happen. To prevent that particular thing, what will happen? The epiglottis will close. So these are the changes that are going to happen, right? So whenever there is a cytotoxic drug or any drug that you are taking, you are always answering in your like vivas. Any drug, if they ask you about the side effect, you will be answering that nausea and vomiting. Why? Because this chemo receptor trigger zone is present outside the blood brain barrier. So any drug that is going to stimulate this particular center, and whenever this particular center is getting stimulated, what will happen? This center is going to activate your vomiting center in the medulla, and your vomiting center is going to produce these changes, and you will be having nausea and vomiting. First thing. Second thing, it will be having like NK1 receptor also. It will be having receptors. CTZ will be having receptors for neurokinin 1. Neurokinin 1 will be seen in the cases of chemotherapy agents. More specifically, cisplatin they will be talking about. This cisplatin is going to activate this neurokinin 1 receptor, and it will be going to cause what? Same story will happen. It will be going to cause what? Vomiting. Apart from this particular thing, let me make you understand about the one more thing that is very common thing. The questions are being asked. This is your motion sickness. Lots of people are having this particular problem whenever they are going in a bus, or they are traveling in a car. Half of them are outside. They are just doing the vomiting throughout their journey, right? So what is the problem? What is the main thing that is happening? Let me make you understand. There will be in the inner ear itself, there will be a organ that is labyrinth, right? There will be a vestibule in the ear. There will be a vestibule, and this vestibule is going to activate your nucleus, that is your vestibular nuclei. This is going to activate your vestibular nuclei, and it will be having some receptors. What are these receptors? It will be having muscarinic receptor, and it will be having histaminic receptor. So these receptors, they are going to go into cerebellum. They are present in the cerebellum. And now what is going to happen? This particular thing is going to activate your vomiting center, and whenever it is going to activate your vomiting center, you will be having what? You will be having again vomiting. You will be having again vomiting. Apart from this, CTZ center will be having receptor for dopamine also. They will be having receptor for dopamine. So whenever this dopamine will be coming, and this dopamine will be activating this CTZ center, the CTZ center is going to cause vomiting again, right? Apart from this, very important thing we are having, this is your one more receptor that we are having. These are important receptor. These are serotonin receptor or basically 5-HT3 receptor. These are basically serotonin or 5-HT3 receptors. For example, let's take an example. In the stomach, we are having like lots of cells will be there. Let's say there is some problem in the stomach. What is going to happen? Stomach will be having certain cells. These are your enterochromaffin like cells. These are your enterochromaffin cells, and they will be releasing what? They will be releasing histamine. They will be releasing serotonin. 5-HT is serotonin. Now this particular serotonin is going to come and activate this CTZ receptor, and what is going to happen? Again, you are going to have this vomiting center activation, and you will be having what? Vomiting. This 5-HT3 can directly also activate this vomiting center also, because this vomiting center will be having a nucleus that is known as nucleus tractus solitarius, right? They are in sync, right? So this is the basic pathology. Apart from this, those people you must have seen in your like first year of your med school, when you are going to the dissection room, there are some people who are like feeling nauseating. There are some people who are having vomiting just after seeing the body, and there are some people who are very like allergic, or you can say they are having issues like watching the blood. They cannot see the blood. They will be having nausea, or there can be nausea because of some smell. So these are the stimulus. These are the stimulus that is coming from the brain. These are basically collectively they are known as obnoxious stimuli. These are your obnoxious stimuli. So basically just like sight of basically sight of blood, or like flash anything, or maybe due to very bad smell, some people are having activation of this vomiting center, and they will be having what? They will be having what? Vomiting. So if you understand this particular system, how this vomiting is occurring, then it is very easy for you to remember the classification of drugs. Like we can block this 5-HT3. What is going to happen? You are going to have decrement in the vomiting. You can block this M1 receptor. You can also block this H1 receptor in the cases of, this is what? This vestibule and cerebellum is concerned with what? This is majorly concerned with like motion sickness. So you can treat motion sickness, right? What you need to do? You need to block this receptor. Okay, you can block this NK1 receptor in the chemotherapy, so it will be helping in the delayed vomiting. You can also block this 5-HT receptors, like drugs like ondansetron and all those things will be blocking this receptor, and you will be having antiemetic effect, right? So this is the basic classification that you should be understanding. Now we will be discussing about the drugs. Now we will be discussing about the drugs. So emesis means there will be vomiting. So drugs which will be decreasing the vomiting, they are known as anti-emetic drugs. They are known as anti-emetic drugs. They are known as anti-emetics. Right? What are the anti-emetics? So you should be understanding. We are having different classes working on a particular system. Right? We are having first class that we are having is anticholinergic drug. Anticholinergic drugs. Anticholinergic means they are parasympatholytic drugs. You can also call it parasympatholytic. They will be working opposite to the cholinergic system, right? So what are the drugs? What are the examples? You should be remembering at least two examples. One is your hyoscine. Second that we are using is dicyclomine. We are also using scopolamine. Okay, so hyoscine, remember guys, hyoscine is the most effective drug in, this is most effective in motion sickness. This is most effective in motion sickness. Okay, it is going to block this M1 receptor. It is going to block this receptor. Now what will happen? The problem lies in the vestibule. If this receptor is getting blocked, there is no information going to this vomiting center, and there will be no vomiting. There will be decrement in the vomiting. So hyoscine we can use. These are anticholinergic, or you can say muscarinic blockers. These are your muscarinic blockers. Second thing that we are having is dicyclomine. Dicyclomine, remember, we are using for the prophylaxis of same. Prophylaxis of motion sickness. We can use it for prophylaxis of motion sickness. Drug of choice will be different. Apart from this, we are having like HT blockers. 5-HT blockers. We are having 5-HT3 blockers basically. These are your cetrone group of drugs. These are your ondansetron, palinocetrone, palinocetrone. Basically, these are your cetrone group of drugs. And remember, ondansetron is a very commonly used drug. We are using it very commonly. This is a short-acting drug, whereas palino is a long-acting drug. This is a long-acting one. This is short-acting. Then we are having what we can also block the histamine receptor. So we are having H1 blocker. These are your histamine blocker. These are your histamine blocker. What are the examples? One is your promethazine. Remember, it is also going to protect us in the motion sickness. Protection from motion sickness because M1 and H1, both the receptors are working over there. You can see M1 and H1, both the receptors are involved over here. So we can also use promethazine. Apart from this, important drug that is your doxylamine. Doxylamine. Doxylamine is also used in the cases of morning sickness. It is the drug of choice for morning sickness. Morning sickness. It is the drug of choice for morning sickness. Apart from this, we are also using drugs like Synargine. Synargine. Synargine is basically also having this anti-vertigo effect. Anti-vertigo effect apart from the anti-vomiting effect, right? So these are the some of the classes that we can use. Apart from this, we can also use other receptor. We can also block other receptor. What are those receptor? We are having D2 receptor. So dopamine receptor, we can block those dopamine receptor. The name of the drug is chlorpromazine. Promazine group of drugs. The name of the drug is chlorpromazine. We are also having triflupromazine. I'm going to make you understand how these things are going to work. We are also having drugs like, you can remember, haloperidol. Okay. Apart from D2 blocker, we are having neurokinin blocker, or you can also call it substance P blocker, substance P antagonist. These are your aprepitant, nupitant, fosaprepitant. How you can remember? Remember P tent. This is your substance P tent. This is your substance P antagonist. These are your substance P antagonists. These are your neurokinin inhibitors, or they are also known as substance P antagonist. Okay. And lastly, we are also having drugs like prokinetic drug. What are prokinetics? Prokinetic, simple meaning they will be increasing the motility of the GIT. They will be increasing the motility of the GIT. Basically, if the motility of GIT will be increased, what is going to happen? There will be decrease in the peristalsis. There will be decrease in the peristalsis. What are the example you should be remembering? One is your metoclopramide. You are having like cisapride, mozapride, cisapride. Okay, you are also having drugs like domperidone, domperidone. So these are certain examples of prokinetic drugs that you should be remembering, right? So what we have studied till now, let me make a quick summary. So basically, vomiting is happening because of this vomiting center. And whenever this center is going to get activated, you will be having vomiting. There will be relaxation of the lower esophageal sphincter, and you will be having contraction of the diaphragm and the abdominal muscle. Whatever content you are having, it will be coming out, right? So you, when you want to prevent that particular vomiting, you need to identify the receptor and you need to identify the disease, right? If the agents are like cytotoxic agents or chemotherapy, you can give like 5-HT3 blockers. You can also use neurokinin inhibitors, right? If you want to, if there is increase in the dopamine, that will also activate your CTZ receptor, and it is also going to cause vomiting, right? In the vestibule, if you are having problem with the labyrinth, there will be activation of vestibular nuclei via M1 and H1 receptor. So we can block M1 receptor with the anticholinergic drugs. We can also block H1 receptor with the help of histaminic blockers, right? So this is going to block this particular thing, and you will be having a relief from the motion sickness. You will be having relief from the motion sickness, right? The next question that we are having is a 25-year old lady complains of nausea and vomiting during the bus travel. So there is a same case scenario that we are having. A 25-year-old lady complaining of nausea and vomiting during the bus travel. So this is a classical case of motion sickness. This is a classical case of motion sickness. What is the problem? Now try to answer, try to identify. They are asking about the drug of choices. What are the mechanism of action, diagnosis, right? So how you will be understanding what is motion sickness? I've already told you there will be some problem with the labyrinth in the inner ear. If there will be some problem in the labyrinth, what is going to happen? Which nuclei is going to get affected? That is your vestibular nuclei. And this vestibular nuclei is going to have those histaminic and muscarinic receptors. So let's say this is going to disturb your histamine, right? And this histamine is going to activate your receptor on the vomiting center. And now you will be having what? You will be having vomiting. So this is the mechanism of action, right? Now what we want to do, we want to block this particular thing. So the drug of choice for this particular motion sickness will be scopolamine. Scopolamine. We are using scopolamine. It is basically the same class of drug like I have seen, right? It is a muscarinic blocker. So what is going to happen? This histamine and muscarinic receptor, when they are getting blocked, what is going to happen? You are going to have resolvement of this particular disease. That is your muscarinic receptor. So you will be having resolved this particular motion sickness. This is what you should be remembering. So if they ask you in short, the mechanism of action, they will be blocking the muscarinic receptor. They will be blocking the muscarinic receptor on vestibular nuclei. Vestibular nuclei, leading to decrease in the symptoms. Leading to decrease in the symptoms. So this is what is going to be the pathology, and this is going to be the treatment you will be giving in the cases of motion sickness, right? Next is about the prokinetic drug. So what are prokinetic drug? First of all, you need to understand what is like the mechanism. What is the normal physiology? The normal physiology, whenever you are eating food, you will be having like sympathetic and parasympathetic nervous system. So parasympathetic is always concerned with rest and digest. And the neurotransmitter for parasympathetic is, it is also known as cholinergic. So the neurotransmitter will be acetylcholine. Neurotransmitter will be acetylcholine, and you understand what is the function of acetylcholine. Acetylcholine will increase the gastric motility. It will increase the gastric motility. If it will increase the gastric motility, it will also increase the gastric emptying. So whenever there is more acetylcholine, there will be more gastric emptying. Prokinetic drug will be increasing the motility in the GIT. Let me make you understand how it is going to increase the motility in the GIT. Before that, just try to understand, whenever there is serotonin, this particular serotonin is going to increase the acetylcholine. What is the use of this serotonin? It is going to increase the acetylcholine. And second thing, dopamine. Remember, dopamine is going to decrease the levels of acetylcholine in the GIT, right? If there is more dopamine, what is going to happen? There will be less acetylcholine. If there will be less acetylcholine, what is going to happen? There will be slow gastric emptying. There will be decrease in the gastric emptying, right? So what we want to increase the serotonin. We want to decrease the dopamine. And these are the drugs. These are the drugs which are going to act on the 5-HT. These are your 5-HT agonist, prokinetics basically. How prokinetics are going to work? They are basically 5-HT agonists. That means agonist means they will be increasing the serotonin, and they are D2 antagonist. Second receptor, D2 receptor of dopamine, they are blocking that receptor. So what is going to happen? There will be decrease in the dopamine and there will be increase in the serotonin, leading to what? Ultimately, this particular thing is going to lead to increase in the levels of acetylcholine, and this acetylcholine is going to increase the motility in the GIT. Increase the motility in the GIT, increase the gastric emptying. Every content that is present in your GIT, it would be going fast. It would be going fast. So this is what you should be understanding. What are the examples of this prokinetic drugs? What are the examples you should be understanding? These are your first ones. Sisa Pride. We are having like Sisa Pride, Moza Pride, Moza Pride, Sisa Pride, Moza Pride. Remember, Sisa Pride, we don't use now because there is a very specific side effect, that is your QT prolongation. It can cause QT prolongation leading to ventricular fibrillation. The patient might die, right? Prolongation. So it is banned nowadays, right? But the question, they can ask you questions based on this, right? Apart from this, we are having like drugs like metoclopramide. Metoclopramide. Let me write the full form. This is your metoclopramide. Okay. What is the important thing you should be understanding about this metoclopramide? Remember, this is a 5-HT agonist, and this is also D2 antagonist. It is having these two properties. It is activating the 5-HT receptor, leading to increase in serotonin. Increase in serotonin means increase in acetylcholine. It is going to block dopamine receptor. That would also lead to increase in the levels of dopamine, right? Decrease in the levels of dopamine, basically, right? Ultimate function of both of them is to increase the acetylcholine, right? Next example is your domperidone. Next example that we are having is your domperidone. Domperidone. The important thing about this particular thing, it is working only on the D2 receptor. It is not going to work on the 5-HT receptor. It is solely working on the D2 receptors, right? What are the uses of these prokinetic drugs? So these prokinetics will be having simple function. They will be increasing the gastric motility. So we can use them in the cases of like gastroparesis. Wherever there will be decrease in the movements of GIT, we can use this particular drugs like metoclopramide or domperidone, right? Apart from this, we can also use them in the cases of hiccups. And whenever, like for example, I want to perform a surgery of GIT, what I would need to do, I need to clear the GIT. I really want to have a clean GIT. So what I would be doing, I would be giving these injections or these drugs just before like just before the operation, or let's say I want to do endoscopy. I want to go inside and see the like ulcers or something else, right? So in that particular cases, whenever we want the cleaning of GIT, whenever we want the GI cleaning. In that particular situation, what we can give, we can use these prokinetic drugs, and they will be very, very helpful, right? So these are some uses of this prokinetic drug. I hope you understand what is prokinetic drug, right? For metoclopramide, the most important things, the basic understanding I think you have got, right? The most important thing is about the side effect. What is the second most important thing is about the side effect. What is the side effects? Remember, this metoclopramide can also cross the blood-brain barrier. This can also cross the blood-brain barrier. So it can also cross the blood-brain barrier. It will be going to produce CNS side effects, right? If it is blocking this particular if it is crossing that particular blood brain barrier, what will happen? It will be producing some CNS side effect. And what are those CNS side effect? Most specifically, you will be finding these are known as extra pyramidal symptoms, and the most common symptom that you will be finding is your dystonia. With this particular thing, you will be finding a most important symptom, that is dystonia will be there, right? Apart from this, if this particular thing is going to block dopamine, remember, what is the other name of dopamine? What is the other name of dopamine? Dopamine has like four pathway. I'm talking about tuberoinfundibular pathway. So dopamine, when it will be working in the tuberoinfundibular pathway, it is also known as prolactin inhibiting hormone. From your physiology, I think you must be knowing this is also known as prolactin inhibiting hormone, right? And now, whenever we are giving metoclopramide to the patient, what metoclopramide is doing, it is 5-HT agonist and D2 antagonist, right? So what it will be doing, it will be blocking the dopamine. It will be blocking the dopamine. What is going to happen? There will be decrease in the levels of dopamine. Decrease in the levels of dopamine. Decrease in the levels of dopamine. What is going to happen? If there is decrease in the dopamine, dopamine is also known as prolactin inhibiting hormone, right? Now what is going to happen? If there is decrease in the dopamine, there will be increase in the levels of prolactin, increase in the levels of prolactin. And remember, prolactin has a function. What is the function of prolactin? You can just remember, pro means pro. It is going to do the production of milk. It is going to do the production of milk. This is the normal function. And whenever there is more production or overproduction of milk, this particular situation we call it galactoria, right? So you understand what will be the symptom. So whenever you are using this metoclopramide, this patient can also present with the galactoria. And whenever the patient is, whenever a mother is having like galactoria, what will happen? She will be also be having problem with the conception, right? So this thing can also happen, right? So you have to be careful while using these things. It can cause dystonia, it can cause galactoria. But these two problems are avoided in the cases of domperidone. Very, very important, because domperidone will only block D2 receptor. It is going to block the D2 receptor. It is going to block the D2 receptor, but not in the CNS, right? So it generally does not cross the brain barrier, generally does not cross the brain barrier, or a little crossing will be there, does not cross blood brain barrier, but there is no significant side effect that you will be finding, right? So we can use this domperidone in the cases of like mild to moderate. We can use this particular thing in the cases of like mild to moderate cases whenever we want a little action, right? For example, in the cases of like drug induced nausea vomiting, drug induced nausea vomiting, we can also use it. But remember this particular domperidone should not be used in the cases of like motion or morning sickness. Just to make a note, it cannot be used. Remember, it cannot be used in motion or morning sickness. Why? Because it is only working on the D2 receptor. It is only working on the D2 receptor. And in the morning sickness or motion sickness, there will be involvement of M1 and H1 receptor. So we cannot use this particular drug in that particular cases, right? Next question that we are having is about the ondansetron, very, very commonly used drug. We are using this ondansetron. Where it will be working? It will be majorly working on this particular thing. This is your 5-HT3 blocker. This is a 5-HT3 blocker on CTZ center, on chemoreceptor trigger zone center. It will be blocking that 5-HT3, right? It is a most common drug we are using, and it is very potent. It is a very potent antiemetic that we are using. It is very potent antiemetic drugs, and this particular drug we are using it like anything, just like we have studied in the pantoprazole, like in the GIT section, part one in the PPIs, right? We are using this particular drug in any kind of vomiting. So this is drug of choice in most of the vomiting, any vomiting. But there are some indications like maybe you can use it in the post-operative nausea vomiting, in the cases of radiotherapy-induced vomiting, in the cases of chemotherapy-induced vomiting, vomiting due to any drug intake, right? So those type of vomiting, we can use this particular drug in most of the cases. What are the side effects? Remember, don't answer here the side effect nausea and vomiting, because this is the drug for nausea and vomiting. The side effect you have to remember, there can be headache. It can also cause QT prolongation, but that is not very severe. And sometimes it can cause hypotension in the patient, right? These are very, very commonly used drugs. You are using them every now and then in the hospital. So this is pretty much about the ondansetron, right? These are the uses of ondansetron. Next question that we are having is about the treatment of cancer chemotherapy induced vomiting. So first thing we want to do, what is happening whenever a chemotherapy agent is present in the blood. Remember, what is chemotherapy? What is chemotherapy agent? Let me just give you a little bit of insight. Whenever someone is having uncontrolled growth of cell, what is cancer? Cancer will be Cancer will be uncontrolled growth of cells. So whenever there will be uncontrolled growth of cells, what we want to do, we want to kill those cells. And for that particular purpose, we are going to give a drug. These are known as chemotherapy agents. These are the drugs which are going to kill which cells? Those cells which are growing at a faster rate. Those cells which are having high mitotic activity, they are dividing more. And result of that, what is going to happen? You are going to have alopecia, because alopecia is loss of hair. Why loss of hair? Because hairs are growing at a faster rate. So you will be having side effects like alopecia. You will be having bone marrow suppression. Why? Bone marrow is also working very faster rate. There will be bone marrow suppression, right? So those patients who are taking these drugs are going into the body and they will be killing all those cells, right? Because of those drugs, when they will be traveling in our systemic circulation, what is going to happen? They are going to activate a center, that is your chemoreceptor trigger zone center. And this CTZ center is in turn going to cause activation of vomiting center. And now this vomiting center is going to cause vomiting. So to prevent this particular thing, what we can do, we can give drugs like 5-HT3 blockers. We can give drugs like 5-HT3 blockers for any cases. Most of the cases, the vomiting will be stopped. Like the drugs we are going to use are your satrone group of drugs. Remember, palinosatrone is a long-acting drug, right? So these are the drugs we are going to use. But a very, very important thing you have to remember, this is about the cisplatin. Cisplatin is a chemotherapy agent which will cause delayed onset of nausea and vomiting. It will cause delayed nausea and vomiting. Delayed onset nausea and vomiting. And for that particular case, we are giving drugs like substance P inhibitor or neurokinin inhibitors, NK inhibitors. These are the drugs that we are going to use. What are the example? These are your aprepitant. These are your fosaprepitant. Remember one thing about them, right? Normal ondansetron is like very cheap. You can use like you can get it very easily. But this aprepitant or this fosaprepitant, they are costly drugs. They will be costing around 1,000 to 1,500 for just 2 tablets, right? So this is a costly drug. We will be using them in the specific cases of this cisplatin induced nausea and vomiting, because it is a delayed type of vomiting, and cisplatin is a very powerful anti-cancer drug, right? So you have to remember this. These are your substance P antagonists. These are your substance P antagonists used in the cases of this particular thing. Apart from this, all other cases like normal nausea and vomiting, drug induced, and all other cases will be taken care by this particular thing. All other cases will be taken care by this particular 5-HT3 blockers, right? Sometimes we need to add on like steroids also. They are also helpful in decreasing the vomiting reflex, right? So these are the important things, right? Next is about the hyoscine. Hyoscine, what is the short answer we have to write about the hyoscine? Hyoscine in motion sickness. What would be the use of hyoscine? Right? Remember, I've already told you this is most effective. This is a most effective drug in motion sickness. In the cases of motion sickness, basically same story will be happening. Once you understand the concept, remember, once you understand the concept, you can write all the answers, right? So basically what is going to happen? It is a class of anticholinergic drug. It is an anticholinergic drug, and it will be blocking what? It will be blocking muscarinic receptors. And when it will be blocking muscarinic receptor, what is going to happen? You will be having resolving of the motion sickness. Okay, so basically it will block the impulses that are coming from vestibular nuclei. Vestibular nuclei. These are the impulses which are coming from the vestibular nuclei. They will be getting blocked. And once those impulses are getting blocked, what is going to happen? You are going to have treatment of this particular thing. You are going to have treatment of this particular thing. Lastly, we are going to have is about the cisapride. Generally, we are not using cisapride, but let me make you understand what is cisapride. It is a type of prokinetic drug. It is a type of prokinetic drug, and we have already discussed prokinetic ultimate function is what? Ultimate function is to increase the acetylcholine. How we can increase the acetylcholine? Either I can do activation of 5-HT receptor, either I can do activation of 5-HT receptor, basically increasing the serotonin. So we can use 5-HT agonist. I can also give D2 antagonist. I can also give D2 antagonist. So remember, this is more, cisapride is more like, it has more activity on, it has more activity on 5-HT agonist, right? It has more activity on 5-HT agonist, but it lacks or less activity on D2 receptor. So it is more working on the prokinetic part as compared to the antiemetic part. Antiemesis is due to D2 receptor, right? So it is working less on D2 receptor. It will be working more on this particular 5-HT receptor, right? Nowadays, we don't use it because it is banned in India. What are the reason why it is getting banned? Because it can cause QT prolongation in the patient. It can cause QT prolongation in the patient, and this QT prolongation can further proceed to like torsade pointis will be there, and it will further proceed to ventricular fibrillation, which is a deadly condition, right? Ventricular fibrillation can happen, and this ventricular fibrillation can lead to death of the patient. The patient can die. Right. So to prevent that, we are not using this particular drug. We are also having other wonderful drugs that we can use. Right. So these are the examples, right? Let me give you a quick revision for all of them, and then we will be wrapping up, right? So basically, what is going to happen? It's all about this CTZ center. It's all about this vomiting center. Whenever this CTZ center is getting activated, it can get activated by 5-HT3 receptor. It can get activated by D2 receptor. It can also get activated by NK receptor. And what are these two things? These are your M1 blocker and H1 blocker. And apart from that, these are your obnoxious stimuli directly activating your vomiting center, right? So basically, what is going to happen? We can block this 5-HT3 blocker. We are having 5-HT3 blockers. Name of the drugs are cetrons, right? We are having dopamine blockers. We can block the dopamine, right? We are having NK blockers, we are having like substance P inhibitors, we are having muscarinic blocker and H1 blocker also, right? So we can block at every step and we can get our therapeutic effect that we want to have, right? These are your anticholinergic, we are having like hyoscine, we are having dicyclomine, right? We are also having 5-HT3 blockers, these we have already discussed. H1 blocker, drug of choice for morning sickness, that is your doxylamine. Drug of choice for motion sickness will be scopolamine, right? D2 blocker, we are also having D2 blocker effect, and neurokinin inhibitor or substance P antagonist. These are your P-tent group of drugs. Substance P-tent. Tent is basically antagonist, ANT, right? So this is antagonist group of drugs. And lastly, we are having what? Prokinetic drugs. These are the drugs which will increase the GI motility by increasing the by increasing the acetylcholine. Basically, whenever there is more acetylcholine is parasympathetic nervous system. Whenever, what is the function of parasympathetic? That is rest and digest. So whenever there will be more acetylcholine, there will be more in the contraction, and there will be more in the more motility will be increased, gastric emptying will be increased. Motion sickness we have already seen. So these are the drugs that you have to remember as far as this vomiting part is concerned. Thank you so much for watching, and you can always download our application on Google Play and App Store, right? And you can always connect back on the social media handles, that is YouTube, Instagram, Facebook, and Telegram. We will be meeting in the next class for the GIT part 3, where we will be discussing about the diarrhea and laxatives, right? Okay.